pandemic. This hearing comes at a critical moment. The number of U.S. coronavirus cases is surging, topping 50,000 per day for the first time on July 1 and setting alarming records for new cases over the past week. Dr. Anthony Fauci recently warned that U.S. cases could double to 100,000 per day if current outbreaks in the South and West are not contained, putting the entire country at risk. As infections threaten to spiral out of control, President Trump has tried to downplay the impact of COVID-19, calling 99% of cases totally harmless, even as more than 130,000 Americans have died and many more have become seriously ill. Just this week, he falsely claimed the U.S. coronavirus death rate is the lowest in the world, when in fact it is among the highest. Unfortunately, the president's comment come as no surprise. His administration's response to the coronavirus has been an abject failure by any reasonable measure. He ignored early intelligence on the virus, continues to disregard the opinions of doctors and scientists, including those in his own administration, and perpetuates misinformation about COVID-19 rather than allowing the experts to speak directly to the American people about the disease. Just yesterday, Congress received notification that the president has begun the process of withdrawing the United States from the World Health Organization in the midst of a pandemic, endangering global health against our own interests. The president has shirked his administration's responsibility to prepare and respond to the pandemic and his own obligation to the nation in a time of crisis, shifting the burden to state and local governments and the people and the American people. The effect of American lives lost and damage to our economy have been devastating. The United States currently has 20% of the world's coronavirus cases, despite having only 4% of the world's population. As the countries are bringing their outbreaks under control, U.S. cases are headed in the opposite direction. Meanwhile, President Trump continues to deny the severity of the problem and is instead focused on his own reelection campaign. Many state and local governments, public health officials, hospitals, and medical workers are doing the best they can under the circumstances. But we need real leadership at the federal level if our country is to overcome the COVID-19 pandemic. Today, we will hear from those who have taken action where the administration has failed to do so: a governor, a mayor, a public health official, and an emergency manager. They are in many ways on the front line of this worsening pandemic, obtaining PPEs and testing supplies, requiring masks and social distancing, and sounds the alarm about the devastating effects of this disease on minority and economically disadvantaged communities. I hope to hear their testimony about what needs to be done to reverse the current trend of cases to protect our health and our economy. The American people are counting on us. I thank the witnesses and my colleagues for participating today. The chair now recognizes the ranking member of the full committee, the gentleman from Alabama, Mr. Rogers, for an opening statement.
Thank you, Mr. Chairman, and I appreciate you granting my request to allow members to use the hearing room today. As you know, I strongly disagree with the unilateral decision to shut down the House of Representatives. We should be conducting our important oversight and legislative business here in Washington. We are much more productive when members are here in person doing our work together. We've always proven that we can do it safely. I hope we will return to regular order as soon as possible. As I said before, our hearts go out to those who have lost their loved ones to COVID-19 and those who are currently undergoing treatment. COVID-19 is an unprecedented global pandemic that requires unprecedented response. Unfortunately, we lost time early in the response when China hid the disease from the world. For weeks, the Chinese Communist Party refused entry to outside medical experts. The Chinese suppressed journalists reporting. Worst of all, China deliberately withheld evidence of the virus's structure and deadly spread. During this, the Chinese hoarded life-saving medical supplies and encouraged foreign travel, seeding the virus across the globe. I want to commend Ranking Member McCall's work on the Foreign Affairs Committee to extensively document this deadly cover-up in a recent report. It's clear that China has pulled out all the stops to manipulate everyone from media outlets to the World Health Organization. The WHO maintained for months that China had promptly self-reported COVID-19. They did not. After months of lying, the WHO has come clean. The WHO now says it found out about COVID from media reports and whistleblowers from within China. The Chinese Communist Party once again has been caught with blood on its hand. Facing an extraordinary public health crisis, China's deadly cover-up, the Trump administration has responded with a whole-of-government response. To date, the administration has prohibited the entry of travelers from global hotspots, invoked the Defense Production Act to increase supplies of critically needed medical equipment, such as ventilators, coordinated the delivery of 176 million respirators, 682 million surgical masks, and 17 billion gloves, sent over $125 billion to the states to support medical response to COVID-19, distributed over $500 billion in PPP loans to small businesses, helped facilitate the testing of over 36 million tests. In fact, we are now capable of conducting over 700,000 tests per day. That's good news. The bad news is the number of positive tests are rising in many states. That's why it's important for all Americans to continue to heed the advice of our federal government, state, and local public health officials. I'm pleased to see a couple of public health emergency response officials on the panel today. Colonel Hastings currently serves as the director of Alabama's Emergency Management Agency. He has a very distinguished career, 30-year career in the Air Force. For the last 3 years, he has done a tremendous job leading the EMA's response to several natural disasters and now the COVID-19. Colonel, thank you for joining us today. I appreciate all the witnesses for appearing. I look forward to hearing you all, hearing how you are using the emergency funding and support resources provided by Congress and the administration to respond to this crisis. I'm also interested in knowing what more Congress can do effectively to help you respond. Our country has faced outbreaks of serious disease in the past. In each case, we have marshaled our collective resources and ingenuity to overcome the crisis. I'm confident that will be the case with COVID-19. Thank you, Mr. Chairman, and I yield back. Can y'all hear the chairman? I can't either.
Can you hear me now?
Yes, yes.
All right. Other members of the committee are reminded that under the committee rules, opening statements may be submitted for the record. I will yield to the ranking member for the purposes of a colloquy.
Thank you, Mr. Chairman. Could you please explain our agreement on the committee procedures during these remote proceedings?
I thank the ranking member. Let me begin by saying that standing House and committee rules and practice will continue to apply during this remote proceedings. Members will be expected to continue to adhere to the rules of the committee and the House. During the covered period as designated by the Speaker, the committee will operate in accordance with House Resolution 965 and the subsequent guidance from the Rules Committee in a manner that respects the right of all members to participate. The technology we are utilizing today requires us to make some small modifications to ensure that the members can fully participate in these proceedings.
Thank you, Mr. Chairman. Could you elaborate on how members may expect to be recognized during the remote proceeding?
Thank you. First, to simplify the order of questioning, I'll recognize members for their 5 minutes questioning based on a strict seniority basis as determined by our committee roster, a departure from previous procedure. Members must be visible to the chair in order to be considered as present for purposes of establishing a quorum or for voting. Members should make every effort to remain visible on screen throughout the proceedings. If a member experiences issues with their video stream, they may proceed with solely audio to ensure connection, provided they have been identified previously. At the beginning of this hearing, members are muted. Members may unmute themselves in order to be recognized for purposes of their 5 minute questioning of the witnesses. At the conclusion of speaking, members will be expected to then mute themselves to prevent excess background noise. If a member does not mute themselves after speaking, the clerk has been directed to mute members to avoid inadvertent background noise. Should a member wish to be recognized to make a motion, they must unmute themselves and seek recognition at the appropriate time.
Thank you, Mr. Chairman. What could a member expect should they encounter technical issues during this remote event?
In the event a member encounters technical issues that prevent them from being recognized for their questioning, I will move to the next available member of the same party, and I will recognize that member at the next appropriate time slot, provided they have returned to the proceeding. Should a member's time be interrupted by a technical issue, I will recognize that member at the next appropriate spot for the remainder of their time once that issue has been resolved. If I should encounter technical issues myself, the vice chair of the committee, if available, or the next most senior member of the majority shall assume the duties of the chair until I'm able to return to the proceedings.
Thank you, Mr. Chairman. What should members expect regarding decorum during the remote event?
Thank you again. Members are reminded that they are only allowed to attend one virtual event at a time. Should they need to attend another committee proceeding, please fully exit the hearing before entering another proceeding. Finally, all members are reminded that they are expected to observe standing rules of committee decorum for appropriate attire and should have a professional and apolitical background when they are participating in any remote event.
Thank you, Mr. Chairman. What should members expect if a witness loses connectivity?
In event a witness loses connectivity during testimony or questioning, I will preserve their time as staff address the technical issue. I may need to recess the proceeding to provide time for the witness to reconnect.
Thank you, Mr. Chairman. Finally, what should members expect if a vote's called during a remote event?
HRES 965 requires members to be visibly present to have their vote recorded during a remote event. Members who join the proceeding after a vote is called and who are not called upon for their vote should seek recognition from the chair to ensure their vote is recorded. Should a member lose connectivity during a roll call vote, I'll hold the vote open for a period of time to address the technical issue and provide members with an opportunity to have their vote recorded.
Thank you, Mr. Chairman. I yield back.
With that, I ask unanimous consent to waive Committee Rule 8A2 during committee remote proceedings under the covered period designated by the Speaker under House Resolution 965. Without objection, so ordered. I welcome our panel of witnesses. I yield to the Vice Chair of the committee, Ms. Underwood of Illinois, to introduce our first witness.
Thank you, Mr. Chairman. Our first witness is the Honorable J.B. Pritzker, the Governor of the great state of Illinois. Before becoming governor, Mr. Pritzker was a national leader in early childhood education for over 20 years and earned his law degree from Northwestern University. We're so glad to have him on the panel today to discuss his experience leading a state of nearly 13 million people through this challenging time, including one of the largest cities in the country, as well as extensive suburban and rural areas with very different needs. Back in March, we heard testimony from Dr. Ngozi Ezike, the director of the Illinois Department of Public Health, and I'm looking forward to getting an update today from Governor Pritzker. Welcome, Governor. I yield back.
Thank you very much. Our second witness is the Honorable Jason Shelton, the mayor of Tupelo, Mississippi. And for those who are on here who might not know, Elvis Presley was born in Tupelo, Mississippi.
I'll just take
Mr. Shelton, after practicing law in Tupelo for more than a decade, Mr. Shelton was first elected mayor in 2013. Under his leadership, the city of Tupelo received the 2015 All-American City Award. Welcome, Mr. Mayor. Since we have two members of the panel who are from Houston, Texas, I'll yield first to the gentlewoman from Houston, Ms. Jackson Lee, to introduce our third witness. And after that, I'll yield to the gentleman from Houston, Texas, also to finish that introduction. Ms. Jackson Lee.
Mr. Chairman, thank you very much. And to the committee members and the ranking member, to all of the witnesses, thank you for your presence at this very important hearing. Dr. Shaw, my pleasure, my good friend, Dr. Umair Shaw, is the Executive Director and Local Health Authority of Harris County Public Health since 2013. Under Dr. Shaw's leadership, Harris County Public Health is a nationally recognized $100 million agency of 700 public health professionals serving the nation's third largest county with 4.5 million. He has been a strong, important, and interesting but provocative messenger on the importance of the health challenges throughout the nation and really around the world. We work together on the issue dealing with the Zika virus, environmental health threats, creosote contamination, and he has been a strong voice in the needs of the county as it relates to COVID-19 pandemic. Today in Houston, the most important titles a person can have is doctor or nurse, and he is that as it deals with COVID-19 patients. He has been involved with the care of patients as relates to the Harris County Health, and he previously worked as an emergency department physician at Houston's VA Medical Center and as chief medical officer of Galveston County Health District. He earned his MD from the University of Toledo Health Science Center. We're very delighted to have Dr. Umair Shaw, who is a voice of leadership, but also guidance during Houston's very, very difficult times fighting COVID-19. Thank you, Mr. Chairman. Delighted to be able to have the privilege of introducing Dr. Shaw.
Thank you very much. Now yield to the gentleman from Houston, Texas to complete the introduction. Unmute yourself. Well, the gentleman from Houston unmute himself.
The gentleman believes he's done so, Mr. Chairman. Thank you for the reminder. Greatly appreciated. Thank you to the staff for the outstanding job they've done with this transmission. Saving Al Green, I think we've done an exceptionally fine job. Mr. Chairman, one of the hallmarks of Dr. Shaw's luminously illustrious career is that he gets involved. He responds. He responded to Tropical Storm Allison, Hurricanes Katrina and Haiti. He responded to Ebola and Zika. He has served as the medical branch co-director, and he did so at a time when in my district we had some 27,000 persons to move from Louisiana, my home state, to Houston, Texas, into my congressional district. He was there for the evacuees when they were housed over at the Astrodome. I am honored to have him as a dear friend, and we are pleased to know that he serves our constituents not only in the 9th Congressional District, but across the length and breadth of the state of Texas and indirectly across the country. Thank you for being here, Mr. Shaw, Dr. Shaw, if you will, and thank you for your involvement.
Our final witness, as acknowledged by the ranking member, is Colonel Brian Hastings, the Director of Alabama Emergency Management Agency. Since August 2017, Colonel Hastings previously served in the United States Air Force for over 30 years. For his military service, Colonel Hastings earned 2 Legion of Merit medals, the Bronze Star, and 3 Meritorious Service medals. Welcome to the panel, Colonel. Without objections, the witnesses' full statements will be inserted in the record. I now ask each witness to summarize his statement for 5 minutes, beginning with Governor Pritzker.
Thank you very much, Mr. Chairman. Chairman Thompson, Ranking Member Rogers, and members of the committee, thank you for the invitation to testify about our national response to the ongoing COVID-19 pandemic. Illinois is the sixth most populous state with the fifth largest economy. We have some of the world's best hospitals like Northwestern Memorial and Rush, and we have renowned researchers, modelers, and public health experts at world-class institutions like the University of Illinois and the University of Chicago. And when it became clear that COVID-19 was not a phenomenon limited to Asia or to Europe, we fully expected the federal government, home of the Centers for Disease Control and the U.S. Department of Health and Human Services, would arm the states with information and equipment and testing capability and personnel. After all, the federal government had the experience fighting H1N1, SARS, and Ebola. A global pandemic requires a national response, but that's not what happened. First, though, I want to talk about what did happen. We took action here early with Illinois' hospital leaders, epidemiologists, modelers, public health officials, and emergency management leaders quickly helping to put plans together. We were among the first states to close nursing homes to visitors and do wellness checks on the staff. In consultation with local officials, I shut down St. Patrick's Day celebrations and then closed bars and restaurants and then schools. And we were the second state in the nation to issue a stay-at-home order. The federal government wasn't leading. We were. Illinois is home to the country's third largest metropolitan area and to major international transit and tourism sectors. We had all the potential to become a major early hotspot like New York and like Florida and Texas have now become. Early March projections showed that without intervention, our healthcare system would be overrun, leading to tens of thousands more deaths. Our curve peaked approximately 6 weeks later. Today, our COVID-related deaths per day are down 85% from a high 8 weeks ago. Even as our testing continues to grow to over 30,000 tests per day now, our COVID cases are down 71% from a high 9 weeks ago. And the number of COVID-positive hospitalizations, including in the ICU, has dropped by over 70% since early May. Our case positivity rate was over 23% at one point, and it's now at around 2.5%. That isn't to say that the cascade of decisions that got Illinois to this point were easy. In fact, every one of them has been a choice between bad and worse, muddled further by the White House's broken promises on testing supplies and PPE deliveries. I spoke with many of my fellow governors, Democrats and Republicans. They had the same problems. Because the Defense Production Act was not broadly invoked early enough, we were in a bidding war for life-saving supplies against each other and against our international allies. We were paying $5 for masks that should have cost 85 cents. There were states calling other states to try and figure out if some international businessman offering a warehouse of 2 million N95 masks was a scammer. Many were. In the midst of a global pandemic, states were forced to play some sort of sick Hunger Games game show to save the lives of our people. Let me be clear, this is not a reality TV show. These are real things that are happening in the United States of America in the year 2020. And if there's one job government has, it's to respond to a life-threatening emergency. But when the same emergency is crashing down on every state at once, that's a national emergency, and it requires a national response. Medical professionals across the nation are crying out for supplies. It's the federal government's job to make sure that a nurse being properly equipped in Peoria, Illinois, doesn't come at the cost of a doctor being ready for work in San Antonio, Texas. There was no national plan to acquire PPE or testing supplies, and as a result, people died. I am so grateful to the incredible experienced public servants inside of FEMA, the CDC, HHS, the VA, and the Army Corps who worked so hard along the way to give us their expertise and assistance. We will need more of that before we will have vanquished COVID-19. I want to offer my thoughts on what the federal government can still do to step up and help us get through this pandemic. First, we need to see a coordinated national strategy for containment. That means more testing and more contact tracing, and it may even mean national restrictions that will be followed in every state. Second, every state has suffered revenue loss because of COVID-19, and without help, there will be massive layoffs of public servants, teachers, and firefighters. A bipartisan coalition of governors thanks the House of Representatives for taking swift action on state and local support in the HEROES Act. Third, the federal administration also needs to provide clarity on insurance coverage for COVID-19 testing. Testing is not a one-off tactic. We need regular testing across our population. And that means people need to know that their insurance will cover their testing every time. Fourth, we need to continue COVID response funding for the National Guard through next year in the face of a possible, maybe even likely, second wave. And finally, and this might be the most important thing that we can do to save lives, we need a national masking mandate. We instituted ours in Illinois on May 1st, one of the first in the nation, and it aligns with our most significant downward shifts in our infection rate. It's not too late for the federal government to make an impact. In fact, it's more important than ever. So I want to thank all of you, and I look forward to your questions later on in this hearing.
Thank you, Governor. We look forward to your responses to the question. I now recognize Mayor Shelton to summarize his statement for 5 minutes.
Thank you, Chairman Thompson, Ranking Member Rogers, and distinguished members of the Committee on Homeland Security. Thank you for the honor and opportunity to be here with you today to discuss the ongoing devastating impact of COVID-19 on our great nation, and more specifically for me to discuss the impact on local governments. I did hear the chairman mention that can't have political things in the background. I think I've complied with that, but I also do have a not so subtle reminder that I'm from Tupelo behind me, and I hope that that's okay. The adverse impact of the public health crisis and corresponding economic crisis caused by COVID-19 has had a direct negative impact on the ability of local governments all across our nation to provide the basic services that every single American depends on in carrying out their normal day-to-day activities, such as getting to work, providing for their family, and having safety and security in their community. As the members of this committee are aware, nearly 3 million Americans have already been diagnosed with COVID-19, and the number of deaths of Americans is in excess of 130,000 individuals. While some loss of life from the pandemic is likely unavoidable, in my opinion, many of these deaths could have been prevented by a quicker and more uniform response from our nation's Commander-in-Chief and his administration. Rational, stable, and consistent leadership based upon medical and scientific data is desperately needed from our nation's highest office during this very real pandemic. Unfortunately, that is missing at this moment. In the last 6 months, we have seen leaders of nations all over the globe respond to this deadly pandemic with rational, science-based decision-making and genuine concern for their citizens and their economies. We've seen leaders from all over the world step up and rise to the occasion. It is past time to see that leadership here in the greatest country on earth. As was mentioned in the chairman's opening statements, our nation has 4% of the world's population, but over 20% of the world's COVID cases. Similarly, we have over 20% of the world's deaths right here in the United States. My purpose here to speak today is about the hardships faced by local governments, which are on the front line responding to our nation's health and economic crises. Mayors, county officials, parish officials, and others are on the front lines and doing all that they can do to enact local policies that are based on science and the recommendations of our nation's top agencies and experts. Their efforts, however, are being hamstrung by the lack of rational, stable, and science-based leadership in the White House. Due to the continued political climate surrounding COVID-19, our cities continue to have difficulty in getting individuals and businesses to comply with the safety measures to prevent COVID-19 related sickness and death in our city. This will prolong both the health and economic crisis in our community. The city of Tupelo has been very proactive. We initiated our emergency response February 24th of this year. Since that time, I've issued 17 different executive orders, all ratified by our bipartisan city council to combat COVID-19. COVID-19 does not recognize a city limits or even a county or state border. That is why national mandatory policies are needed if we're going to truly combat the healthcare and economic crises facing our nation. I want to take this opportunity as mayor of the city of Tupelo, as a member of the Small Towns Council of the National League of Cities, to thank the members of this committee and this collective body for passing the CARES Act legislation. This is a great thing for our country. I also want to thank the members who have supported the HEROES Act and the SMART Act. Those pieces of legislation get resources to local governments that are desperately needed. That is the gist of my testimony today, to advocate that direct federal funding be delivered to local governments so that we can offset the loss of revenue. The National League of Cities anticipates about a $360 billion loss of revenue for local governments over the next 3 years. We need funding to be able to provide the very basics that every American depends on to get to work every day. Garbage, trash collection, litter, fixing potholes, fixing a red light that's not working, fire protection, public safety, EMTs, the things that every American depends on each and every day. Those things, those functions of government happen here at the local level. The lost revenue due to the economic crisis of COVID-19 is going to severely diminish our ability to provide those basic services, and that's why direct funding from the federal government to local governments is desperately needed. Former Speaker Tip O'Neill famously said that all politics is local, and while the solutions will likely be debated in Washington and our state capitals, they will be implemented where literally the rubber meets the road, right here in our local governments. Thank you again for allowing me, Chairman Thompson, Ranking Member Rogers, members of this committee. Thank you for allowing me the opportunity to be here to advocate for local governments. And I appreciate the opportunity to speak to you and look forward to answering any questions that you may have for me. Thank you.
Thank you for your testimony. I now recognize Dr. Shaw to summarize his statement for 5 minutes.
Thank you, Chairman Thompson, Ranking Member Roger, and members of the committee and subcommittee. Members of the Texas delegation, Representatives Sheila Jackson-Lee, Al Green, Dan Crenshaw, and Michael McCall. I want to thank all of you in particular. My name is Dr. Umair Shah. I'm the Executive Director and Local Health Authority for Harris County Public Health. I'm past president of NACHO, who represents the nearly 3,000 local health departments across the country. Harris County is the third most populous county in the United States with 4.7 million people, including the city of Houston is one of the most diverse and fastest growing metropolitan areas. Population in our community is larger than 25 states. We are no stranger, unfortunately, to emergencies such as storms, hurricanes, fires, and infectious disease responses. From a public health standpoint, there truly is never a dull moment in our community. Unfortunately, the present COVID-19 pandemic has had an unprecedented impact on our community and our nation well beyond health, and has undoubtedly tested the resolve of the American people. Harris County Public Health has responded to H1N1 for 18 months back in 2009, 2010, but tomorrow marks only the 6-month mark for COVID-19. We're truly in a marathon, not a sprint. Today, I'm here to make 3 main points. One, we as a nation still have the opportunity to fight this pandemic, but only by working together. Number 2, all eyes are on Harris County in Texas right now, and despite being successful previously, the situation has now changed. And number 3, public health is key, and we must support and invest in it. Let me start by saying that the local response to COVID-19 led by Harris County Judge Lina Hidalgo has been strong, decisive, and proactive, and has worked closely with other area officials, including Houston Mayor Sylvester Turner. Case in point, Harris County released its 4 T's approach for addressing COVID-19: test, trace, treat, and teamwork from March to May. This approach saw the Harris County community working together successfully to flatten the curve. More recently, the story has changed. Our community has seen an increase in cases, the percentage of tests that are coming back positive, and hospitalizations, including in our county's safety net hospital system. Our threat level for COVID-19 has been raised to red, its highest level. We now have over 39,000 cases and 400 deaths in Harris County. The changing picture in Harris County now demonstrates what I have called the layering effect of reopening in Texas on top of events and holidays such as Mother's Day, Memorial Day, protests and marches, further layering exposure and risk to our community. Inconsistent messaging at the federal, state, and local levels have led to further confusion and complacency at the individual community level. Case in point, CDC has not been consistently visible as the nation's voice of public health. In Texas, while many local officials, elected and health alike, stated clearly that our state was reopening too quickly, the process of reopening continued. Powers of authority previously available at the local level were removed. Fortunately, the state has now begun to dial back reopening. Reopening responsibly means that decisions should be driven primarily by health and medical while balancing other interests. Public health often gets the short end of the stick. It has been chronically underinvested in. I call this the hashtag invisibility crisis. While I've come to this committee before to share similar points, enough is enough. We need to take this seriously if we are ever to course correct in time to protect our communities. Yet when we need it the most, public health is still largely invisible, underappreciated, and underfunded. The COVID-19 public health workforce has been working well beyond 40 hours a week, available 24/7, months on end. The public health frontline is committed, but it is facing burnout and stretched to its limit. In the span of 4 months, our department has doubled its own workforce. Our epidemiology team has gone from 25 to 500. This massive scaling for COVID-19 has proven necessary, but without reliable and secure funding outside of reactionary and supplemental funds, it is simply not sustainable. Daily, our leadership juggle needs between essential public health services and the COVID-19 response, and we are not alone across the country. This is where the federal government comes in. The primary financing mechanism to expand capacity is through CDC's ELC grant. For example, our department is ineligible for direct funding, and yet the same mechanism has been used for the COVID-19 response. The pandemic must be fought together. It has felt like every health department has been left on its own trying to create new systems for response in real time. While federal support is appreciated, federal testing sites were planning to cease operations at the very time we were seeing increasing need. Similar issues are likely to play out again when vaccinations become available, meaning proactive planning for vaccine distribution is needed soon. Although scaling of testing has increased, results take too long to reach health departments, especially at government-supported sites. The data exchange is moving slower than the disease. With this delay, public health measures become less effective. This is especially true for those most vulnerable, such as disproportionately impacted communities and those in congregate settings. We're equally concerned with the health inequities seen in Hispanic and African American communities in this response. If the federal government expects there to be robust systems of surveillance, better data and informatics capacity is needed at the local level. This includes CDC support for innovative study of disease patterns in Harris County, utilizing state-of-the-art technologies and genetic sequencing. As a workaround, our department has had to develop new data systems, public-facing data dashboards, and online screening tools for testing on its own. Those local efforts are necessary to get the job done, but they were reactive as national efforts to modernize such systems have failed. Let me close by saying the pandemic is an unprecedented time for our country. We are being tested like never before. Smart, strategic, scalable, and sustainable investments are needed now. All eyes are on Texas and Harris County. We should be able to look to the federal government for leadership and support. On behalf of Harris County Public Health and our public health colleagues across the nation, the offensive line of the football team, I appreciate again the opportunity to testify today. Along with our local leadership, we join you in working together in fighting COVID-19 to protect our national security, our economic vitality, and the very health of our people. Thank you.
Thank you very much, Doctor. I now recognize Colonel Hastings to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson, Ranking Member Rogers, and members of the committee. On behalf of Alabama Governor Kay Ivey, thank you for inviting the Alabama Emergency Management Agency to participate in today's hearing. I'm here before you as the director of the Alabama Emergency Management Agency, and we are the state's lead agency for the coordination of Alabama's all hazards mitigation, preparedness, response, and recovery activities. Thank you for the opportunity to share with you Alabama's perspectives and our experiences preparing for and responding to COVID-19. Over the last 4 months, Alabama has transitioned from a stay-at-home order issued on 20 March to a safer-at-home order issued on 30 April. The latest order from Governor Ivey has recently been amended and extended through 31 July. When this pandemic began, Alabama was fortunate that ADPH, our Department of Public Health, had on hand an existing stockpile of PPE left over from the H1N1 response over a decade ago. This stockpile of PPE was mostly expired, but was able to be distributed early in our response to COVID-19 with the help of a waiver granted by the U.S. Food and Drug Administration. The initial push of ADPH's existing PPE stockpile, combined with a slow rise in COVID-19 cases and the release of federal strategic national stockpile, helped reduce the initial shock of the global PPE supply and demand crisis. Today, the healthcare supply chain is still struggling to provide medical-grade respirators, some disinfectants, and other specific personal protective equipment. This supply and demand mismatch continues to plague Alabama, just as in many other states, as we continue to provide PPE to the healthcare system while simultaneously working to replenish our state stockpile in preparation for the fall surge of COVID-19. As a state EMA director, I appreciated the more active role FEMA played as the U.S. coronavirus response evolved. Even though the dual reporting change of HHS and FEMA were sometimes cumbersome, it was better than not receiving critical coronavirus response information, and the relationship provided much needed visibility into the U.S. public health response at a national level that we lacked to some extent during the early days of the federal government's response. The combination and co-location of FEMA and HHS leadership was mirrored in Alabama's own unified command stood up on 30 March. We found that this helped our communication information flow across and within our state agencies. This combined construct with the close coordination enables between emergency management and public health officials should be purposefully encouraged in federally supported preparedness programs. This would reduce duplication and streamline coordination and preparedness outcomes driven by the separate HHS and DHS FEMA emergency preparedness funding programs, of which FEMA's emergency management performance grants and HHS public health emergency preparedness programs are two prominent examples. As the U.S. develops future strategies and policies for pandemics, all hazards emergency management activities, and threats to national security, I offer a few items for consideration to our federal partners. Assess public health vulnerabilities to national security based on comprehensive supply chain analysis to include the location of raw materials, availability of production resources, transportation vulnerabilities, and location of manufacturing. 2, with regard to the CARES Act and the crucial financial support it provides the state and local government, there are lingering questions about eligibility that at this time are causing some level of confusion at the state and local levels. For example, it is unclear whether CARES funding may be lawfully used to accommodate the extraordinary expenses of emergency management agencies like AMA that have been incurred in responding to COVID-19, even though the vast majority of our personnel expenses have been dedicated to that end to date. Increased clarity on the intended and allowable uses of CARES funding would enable state and local officials to make better decisions about the most effective and responsible uses of this essential emergency funding mechanism as we work to maintain government operations during this crisis. Requirements that are too restrictive or specific in our emergency preparedness funding programs, whether in authorizing legislation or in the implementing guidance passed down from federal agencies, often create very distinct functional cylinders of excellence and siloed functional expertise in a way that is inwardly focused, instead of enabling cooperation and sharing of resources in a fully integrated national emergency management and preparedness enterprise. Our focus should be on fostering an outward sharing of resources and information that is incentivized by federal grants aimed towards developing capabilities with commonality, interconnectedness, and partnerships instead of driving duplication, competition, or stovepipes. This is especially pertinent in terms of overlap between and sometimes competing objectives of the FEMA and HHS emergency preparedness funding programs. And lastly, in accordance with FEMA's framework of federally supported, state-managed, and locally executed disaster activities, please give consideration to the role that subdivisions of government and private partners should play in stockpiling resources for future pandemics or building local capability. If the federal government focuses too much only on federal responsibilities, the U.S. may miss an opportunity to create a whole of government and whole of society approach to preparing for future pandemics and complex disasters. We all play a role in emergency preparedness, so the strategic national stockpile should be a multi-tiered national system comprised of integrated whole of government, whole of business, and whole of society partnerships to strengthen the resiliency of the United States at all levels: state, local, tribal, territorial, and federal. In conclusion, I'm proud to say that Alabama remains committed to fighting the coronavirus, reducing loss of life, and minimizing the suffering of our citizens. As our nation continues to respond to this public health crisis, we ask that you remain attentive to the evolving needs of each state, in particular Alabama, and mobilize the information, resources, and funding capabilities of the federal government that are needed to protect our nation's public health and safety. Again, thank you for this opportunity to testify. Thank you for your support of the CARES Act, and to our federal partners who have partnered with us in the response, and I welcome your questions. Thank you.
I thank the witnesses for that testimony. I remind each member that he or she will have 5 minutes to question the panel. I'll now recognize myself for questions. Governor John Hopkins University has documented the disproportionate number of deaths in the U.S., the disproportionate number of testing. How do you think we got to this point in the United States that our people are dying more disproportionately than others? And after you say that, can you give us what you think we ought to be doing that we didn't do?
Well, you're talking about communities of color, right? I just want to make sure, because that's, from my perspective, this is something that was so overlooked in the very first weeks of the pandemic in the United States. And then as the data was coming out, I think all of us, that care about this jumped on it and tried to figure out what are the things that we can do to make up for, to try to, diminish the negative impact of coronavirus, particularly on the African-American community, the Latino community, the Asian community. Here, look, this is the conclusion that you have to reach, which is this is a result of, frankly, hundreds of years of failure to invest in basic healthcare, basic needs, investment in communities that has been lacking for so long. And the result is that, you hear a lot about the comorbidities that exist in the African-American community. Well, those don't just exist by accident. They exist because we haven't invested in those communities. And so people suffer from the comorbidities more, guess what, in communities where there's more poverty. So, from my perspective, to counter this, we put a lot of testing capability into, at least here in Illinois, into communities of color, particularly Black communities. We've seen, of course, a disproportionate number of Black people who get coronavirus dying from coronavirus. We also see a disproportionate number of Latinos getting coronavirus relative to their population size. And so in both of those circumstances, we had to react. There are different challenges in each of those communities that we had to react to. But when you ask me what are the causes, I mean, the causes are things that have existed for many, many years that only now, I think, not just with coronavirus highlighting the failures, but now on top of that, the recognition as a result of the outpouring of protest and peaceful protest in the wake of the murder of George Floyd, that we need to do so much more, and we're not prepared in this pandemic to deal with it. We need to make sure that we're doing everything we can now, but we also need to make sure we put the resources in so that, God forbid, that we have another pandemic. This isn't.
Thank you. Dr. Shaw, you talked about a few things that we could do right now to try to mitigate the increase in the numbers. Can you kind of repeat that for the members again?
Sure. Thank you. Thank you, Mr. Chairman. To say it very bluntly is that we have to make sure that we are consistent in our policies and our messaging. I think that is the number one thing. The second thing is that we also have to make sure that health and medical and science and evidence, the best we can, we know it's not always there because this is a novel disease, that is also driving those decisions. And we're particularly concerned about the CDC and the fact that the visibility and the leadership that we've seen previously with CDC that has not been noted, at least at the local levels in public health. And that is a significant concern. And then I do think that there are some preventive measures that are very much about the masks and really ensuring that we have the policies in place from a prevention standpoint that really can be very much a part of the solution forward. We have to be smart about it, but we also have to be thinking about how we can continue to move this process forward, because the phased approach that we're having in our community is very different than the governor is having in Illinois right now, or you're having in Mississippi. Everybody's going through this at different times, and so we all have to be working together.
Thank you very much. Mayor Shelton, you were one of the first municipalities in Mississippi to require masks of your citizens, and your council supported you. How did you reach that conclusion? Unmute yourself.
Apologize for that. Thank you, Chairman. We began our emergency protocol February 24th. We saw the pandemic coming towards us, so we made the decision then that this is an emergency, so we have to treat it like an emergency. So the 17 different executive orders have done since then have all been based on the recommendations of either Dr. Fauci or the CDC, the Mississippi Department of Health. We've tried to follow the science. We've had we have the nation's largest rural hospital here in Tupelo, the North Mississippi Medical Center. A lot of the requirements that we've mandated have come from requests from the North Mississippi Medical Center. I appreciate getting credit for that, though I want to take up from my friend Mayor Robin Tannehill in Oxford and some of the others. Tupelo was not the first on the mask. We have been first on shelter in place and some of the other things, but I want to give credit to my fellow mayors for credit's due. But we base those decisions on the science, the recommendation, and in our case, the request of our medical professionals here. This is a healthcare crisis. We have to listen to our healthcare professionals. We have to make sound decisions based on the science.
Thank you very much. At the request of the ranking member, we're going to recognize Mr. Higgins, who has a flight to catch. Gentleman from Louisiana, recognized for 5 minutes.
I thank the chairman and the ranking member, and I thank the chairman for holding this hearing. As the chairman and my colleagues are aware, I respectfully object to House proxy voting and remote committee attendance. The Senate is open and working in person. The White House is open and working in person, yet the House is not. Walmart, Home Depot, Lowe's, grocery stores, police departments, fire departments, maritime ports, airports, all open, working in person, but not the People's House. That's my position on that. I respect that of my colleagues, but it's important that we clarify our stance on this during this era of challenge. I have a question for the governor. If you would, good sir, could you briefly summarize what formula have you used to deliver CARES Act relief funding into your local government entities? This is a challenge across the country, and I'm interested to hear how you've handled that.
Yep. Well, thank you very much, Congressman, for the question. Let me start with, we began in Illinois with a challenge. We didn't have a method, an entity through which we could distribute those funds. So we had to go to our legislature to have them pass a law to allow us to do that. They did that. The legislature hadn't met during the spring until mid-late May. And at that point, the legislature created the opportunity for us to distribute those funds. There's a direct amount of money that goes directly to the counties and cities across the state, the ones that are outside of the Northeast metropolitan areas, which get those funds through their counties that got funding directly. So the state.
So generally speaking, Governor, in the interest of time,
Yes.
have you? Would it be fair to say that as the executive of your state, you responded to a challenge that has never been faced before, and you have navigated your way through it within the parameters of the law, and you've done your best to respond to the local and municipal governments within your state? Is that a fair summary of your endeavor?
Yes, sir.
And for the subsequent governor, I'm sure you're a fine gentleman and supported obviously by the majority of the citizens of your state. Well, would it be fair to say that for the subsequent governor, you have now determined a path forward for this particular type of challenge that was not known until you navigated through it?
Well, I wouldn't say that we've got everything figured out, Congressman.
But you're working on it.
But we certainly have. There's an awful lot of learning that's taken place from March
That's
until
right.
now, and yes,
So-
I believe that we've created a path for someone in the future to follow.
Thank you. And may I respectfully state that that's exactly what our president has done in response to this incredible challenge that we've never faced before as a nation. I would like to ask the mayor, Mr. Mayor, what's your perspective, sir, for your municipality? Very briefly, have you had problems receiving funds, CARES Act relief funding from your executive? Yes or no?
Congressman, as you know, the CARES Act specifically prohibits loss of revenue funds to be
I understand.
spent.
And yet every state executive had received massive amounts of the people's treasure intended to be distributed by the state executive into local and municipal governments. So as a mayor, you sound like a smart and compassionate man, and we thank you for that. Have you had problems receiving that funding?
Congressman, again, the lost revenue funding is not available. My understanding is that the state is going to send for the PPE funds.
So you haven't received funding yet from your executive?
I'd have to double check that, but not that I've been made aware.
All right, thank you, sir. I don't know how much time we have remaining. We're absent a clock, from what I can see, but 17 seconds. Mr. Hastings, I'll leave you with this question. Do you believe that a public health crisis is best addressed at the local and state level or by federal mandate? And I yield.
I think it depends on your perspective. Growing up in the emergency management community, our strategy for handling all hazards is federally supported, state managed, locally executed. So we try to adhere to that as we partner with the federal government, with our state agencies, and our counties and municipalities, which are the pointy edge of the spear. A caveat to that might be is that as the sixth poorest state in the union and heavily rural populated state, there are some counties and municipalities that need extra support. So we are sensitive to that and identifying gaps and then trying to plug in both federal and state capabilities and resources in those areas as we can.
Thank you for that response. I thank the chairman and the ranking member, my colleagues across the country right now, and here in D.C., Mr. Chairman, I yield.
Thank you very much. We now yield 5 minutes to the gentlelady from Texas, Ms. Jackson Lee.
Thank you very much, Mr. Chairman. I appreciate it very much to have the opportunity. Thank you to the witnesses. In 2016, the Obama administration developed a strategic playbook on pandemic preparedness. The playbook entitled Playbook for Early Response to High Consequences, Emerging Infections, Disease Threats, and Biological Incidences. I'm reminded of the Ebola pandemic, or the Pandola episode, and it started, or it was certainly focused in Dallas, Texas. Had it not been for the focus of the Obama administration on infectious disease and cooperating relationships with the federal government, there is no way of knowing how disastrous Ebola would have been in the United States. The playbook was in the Trump administration, left behind, and it reportedly did not heed its guidance. The mortality rate was cited by the administration as the lowest in the world as it relates to COVID-19. Johns Hopkins indicated that it is the sixth worst in the world. We also heard the words that COVID-19 would go away like magic. Governor Pritzker, thank you for your leadership. Would you created on top of a disaster when there is no national effort, there is no national strategic plan to be able to deal with COVID-19?
Well, thank you very much, Congresswoman. Let me just begin by saying that we had immediately, we knew we needed supplies. And so PPE was something, certainly a term that I don't think I had ever used before in my life. And all of a sudden, we were out in the marketplace competing for the most basic things like N95 masks, gowns and such, to make sure that our hospitals were supplied, and then our first responders and so on. And we're competing against every other state in the United States, states that have more resources than we do, countries that have more resources than we do, with no help from the federal government, no invocation of the Defense Production Act to help us out. So that was just the very first manifestation of the problem, that people were going to work, our heroes, our nurses, our doctors, going to work unable to use PPE that was so necessary to keep them healthy, so they could
Governor,
keep other people healthy. And so that was just one example, but I'll just add that the testing supplies, were impossible to get, and the federal government was, nowhere to be found for too long on that topic.
For those of us who've interacted with the military, we know the saddest terminology is MIA, missing in action. Very sad terminology. We mourn and continue to look for our soldiers. But when you're MIA, lives can be lost. You think lives have been lost throughout the United States because of that ineffective national strategy?
There is no doubt about it. Thousands and thousands of lives have been lost, tens of thousands across the nation as a result of the inaction, the late action taken by the administration.
Thank you, Dr. Shaw. Thank you for your leadership. Let me just cite right now into the record, Harris County has confirmed cases today, 39,311. There have been 395 deaths. This is as of 7 a.m. July 8th this morning. Houston, 55,000 cases confirmed, 581 deaths. This is in totality. I have a document in my hand that I ask unanimous consent to put in the record. Texas coronavirus timeline that was done by a number of individuals reported in the Houston Chronicle that indicates May 1st was when our orders was stay-at-home orders were lifted rather, and then we proceeded to open everything up, and we are now where we are today. Would you please respond to the idea of the ineffectiveness of saving lives when there is no national strategy, or when there is the early and too early opening up of states in particular? And then finally, when there is no cooperation, is it important to have cooperation between county and city governments? And I want to thank Judge Hidalgo and thank Mayor Turner for their leadership. And also, if you would comment on what happens when 5,000 persons are coming to a community that's asked them not to come to, and all of the resources that will have to be used as these people congregate for a convention.
Yeah, thank you, Congresswoman, and thank you again for your support. Let me unpack that as quickly as I can in the interest of time. First and foremost, that in any time you have inconsistencies that are occurring across that chain of federal, state, local, I don't really care where it's at. That's where you have the problems in the community, and that's where my biggest concern is when it comes to what we've really looked at from why people are coming together. It does not matter from a public health standpoint whether it's a red or blue issue, whether it's a left or right issue. When people are coming together, that layers risk on top of each other. And that's the biggest concern, especially if it's an indoor. There is some difference between indoor and outdoor, but definitely an indoor. The other aspect of this that I think is absolutely critical is that as we have played this out, the state and local dynamics are absolutely critical. But when you have the federal government not having a national strategy, what that does is that everybody is fending for themselves. Everybody is doing things differently. While we believe in really state and local nuances, we also believe there should be a path forward that the federal government provides, as we've seen in previous emergencies.
You know, I've worked on testing sites. I'd just like to have you emphasize how important it is to have testing sites, how important it is to continue to have the federal government maintain its testing sites, and how eager Harris Countyans and Houstonians are desperately in need of tests.
That's absolutely right. Testing is the foundation of this response. Folks have focused on contact tracing and all these other, terms in public health as if these are new terms. These are things that we've been doing for decades. But the foundation remains testing. Testing gives you then the cases. Cases then allow you to determine, after investigating, who are the contacts, and that's when contact tracers come into play, and then they turn around and reach out to individuals to get them tested, and you start that whole cycle over again. That's why testing is absolutely critical. And Congresswoman, I've said you cannot trace without a case. And so testing is the foundation, and we do need to have that testing support from the federal government.
Gentlelady's time has expired. We now recognize the ranking member from Alabama for 5 minutes.
Thank you, Mr. Chairman. Mr. Hastings, unfortunately, Alabama's had several natural disasters over the last 3 years that you've had to manage. How are you and your fellow EMA directors adjusting your plans to this health crisis created by COVID-19? And are you getting adequate support from FEMA in this planning process?
Ranking Member Rogers, thanks for that question. In my written testimony, it talks about this has been a banner disaster year again for Alabama as the 7th worst major disaster declaration state in the union. We have been complying with all the CDC and public health guidelines through the transition of stay at home and safer at home. And since we have been essential personnel, we haven't stopped a beat since the beginning. So at the beginning of March, we went into remote and dispersed operations. We deployed our people away from the EOC and stayed connected via IT. And we did not accept, since I declared everyone essential personnel, no one received unemployment, and we kept working. So what we did is we just made sure that we wore masks when we were close to people. We socially distanced as we went out into the communities and working with our counties, because the locals is where the disasters happen, just like politics. And so we have changed the way we have done business. Now, there are some people who did not like that we went so early into remote and dispersed operations, but we were just executing the pandemic annex of our emergency operation plan. And we're fortunate to have our own IT division and a separate network that allows us to do those things. In preparation for the hurricane, which has had a lot of attention recently, we're working with the CDC guideline, public health guidelines, FEMA preparedness plans, the Red Cross, and local communities, both Baldwin and Mobile County, to re-examine the preferred method of non-congregate sheltering. But it's very challenging because, as well as you know, between the coast and middle Alabama, there's not a whole lot. It's the rural South. And so to find opportunities for non-congregate sheltering to house people in a disaster is very challenging. So we're going to have to find a blend of congregate sheltering, complying with public health orders, and then also as soon as we can get our survivors, our evacuees, the folks looking for shelter back into some type of non-congregate shelter in a hotel, a larger amphitheater, or some of those larger coliseums that we have in Montgomery, Alabama, and a few places in the coastal counties. But it has entirely changed everything that we do, and it's made us question of whether we can even go to the state emergency operations center, because you only have 2 feet, 3 feet between 125 people, 100 feet below ground. So we've also looked at other opportunities like the RSA towers in Montgomery, of where maybe we on a floor or Joint Forces headquarters of the National Guard, we would stand up a Joint Force office and administer and partner with our federal, state, and local communities to manage and navigate a disaster in the upcoming season. I hope that answers your question, sir.
Yeah. Well, both the chairman and I care very much about hurricane preparedness, so I appreciate that. But back to COVID-19, you heard Governor Pritzker talk about the demand for PPE. How has Alabama managed demand for PPE outside the healthcare sector?
It's been challenging. As it's evolved, there are portions of the PPE that are now available to us. So we just got 2.5 million cloth masks. We helped the Alabama Superintendent of Education procure 2.5 million masks, partly youth masks and adult masks for the upcoming education season. But where we are having problems, and it's hard to get visibility of the health of the supply chain, and also to actually get our hands on these medical grade masks, are the N95s. So we still have a shortage. As soon as we get any of those in, whether it's from the federal government or a stockpile, it goes right out to the hospitals, and the hospitals are receiving those both from the task force of the White House through normal supply chains, but it's not normal yet. It's not to the levels that it was pre-COVID-19. And then we are working through the big six supply chain, and we have a call with the federal government, the supply chain task force, on Friday to see how Alabama, a small state, can maybe partner with the federal government, other regions, to get higher prioritization for these critical medical masks, both for our hospitals now and to build a stockpile for the upcoming fall COVID surge.
Okay. Mr. Chairman, my time has expired. I'll yield back.
Thank you very much. Chair recognizes the gentleman from Rhode Island, Mr. Langevin, for 5 minutes.
Thank you, Mr. Chairman. I want to thank all of our witnesses for their testimony today. Governor Pritzker, if I could start with you. Thank you for being here today. I just want to go back to the discussion about PPE and the dire challenges you had in acquiring PPE for your state to begin with. You described it as a Hunger Games competition, so to speak. So I think you and I would clearly agree that it would have been much more effective for the president to truly invoke and use the Defense Production Act, where they could have been both used for acquisition and distribution of PPE. We would have gotten a bulk price. The taxpayer would have got a lower price and would have been distributed more effectively. It was the position of the administration, and I've had the opportunity to speak directly with the director of FEMA, that they would acquire the equipment and then they put it into the pipeline, so to speak, but not using the Defense Production Act. Can you tell us where we are today? Did that strategy ever work in terms of putting into the commercial pipeline? how are you in other states doing today in terms of being able to access PPE now?
Two different answers. First of all, the air bridge, as you're talking about, the air bridge was designed to bring supplies, and give them to distributors in the United States who already had a list of customers, not based upon where the need was for dealing with COVID-19, but simply customers that were pre-existing that they needed to provide supplies to, because that's what you do for your customer list, and prioritize them based upon your business dealings. Those supplies, sure, they work their way through the United States, but not prioritized for COVID-19. So I think the air bridge was an utter and complete failure in the sense that most of the supplies need to go to areas where there's a great need, and not necessarily to where some private for-profit distributor thinks they need to feed a pre-existing customer. So that's one thing. Where do we stand now? We have been constantly, from day one, we've been out in the marketplace competing to get PPE, and the state of Illinois as a buyer. I had many conversations directly with manufacturers, and I can remember one in particular who basically said to me, look, unless I will allow you to acquire this amount of these PPE items or this equipment, if you will up your order by X amount so that you're greater than this other customer who is promising to acquire a certain amount. So essentially pitting me against another customer in an environment in which we have a pandemic, people are dying. I'm having to make decisions based on some business person's desire for greater profit. So that was very troubling. Today, we have acquired a lot of PPE. We've made sure that we've got a constant supply, and we have orders that are ongoing on a regular basis. And I would say prices have come down. The environment is a little bit better. It's not back to normal. Someone else on the panel said, this is not pre-COVID pricing, but we're paying a lot less today than we were at the very beginning, and we're able to acquire PPE here in Illinois.
All right, thank you. And hopefully that's the case with other governors in other states, but clearly not the most efficient system. It would have been better to have the PPE be directed to where it's needed most based on need. Let me ask this on pre-existing conditions and health insurance. On June 27th, President Trump had tweeted the following statement. We said, "I will always protect people with pre-existing conditions, always, always, always." Now the Washington Post fact checker has stated that this claim is untrue. So the president's claim that he would protect pre-existing conditions received this rating in part because, and I quote, "in the middle of a pandemic, against the advice of many Republicans, the president is trying to ask the Supreme Court to strike down the entire Affordable Care Act, including coverage guaranteed for people with pre-existing conditions." So, Governor, I want to ask, how does the lack of health insurance, especially in vulnerable populations, exacerbate the current public health crisis? And Governor, as we approach the 30th anniversary of the Americans with Disabilities Act, and I'm someone who lives with a disability, how important is the Affordable Care Act's guaranteed coverage of pre-existing conditions, particularly for people with disabilities?
Well, the guarantee of coverage for pre-existing conditions is vital. It's probably the most important aspect of Obamacare and the expansion of Medicaid. And the idea that we would do away with this, particularly at this moment in history, seems just unimaginable to me. Look, first, we've got to make sure, and I mentioned it in my remarks, we've got to make sure that everybody knows they can get a test for free. That they shouldn't be dissuaded from getting a test, thinking this is going to cost them, a lot of money. Hopefully you've got private coverage, but if you don't, let's make sure everybody can get a test, because that's the most important thing, along with contact tracing, that we can do going forward. Masking being another one, so that we can identify. Testing allows us, and contact tracing allows us to identify where the outbreaks are and minimize them. So we want people to get tested. And then, of course, when people get sick, this is a national emergency. People should be able to get health care. they should be able to get treated. We should be keeping everybody alive and not having people think about whether or not they should go to the hospital in the first place when they're contagious and when they're symptomatic. So I'm very concerned about where we are. And all I can say is that we've got to make sure we maintain our Medicaid coverage and make sure that particularly people who are having difficulty getting testing know that it is absolutely free to them.
Good. Governor, thank you very much. I know my time's expired. Chairman, I yield back, but I thank all of our witnesses.
Thank you very much. We now recognize the gentleman from New York for 5 minutes, Mr. Katko.
Thank you, Mr. Chairman, and thank you all for being here. Governor Pritzker, just a very quick, succinct question. Via the air bridge, did the state of Illinois get stockpiles of PPE that were being brought in, and then you decide where to disperse that throughout the state? Because I know that's what happened in New York.
Not through the air bridge. The air bridge was bringing in equipment, PPE, that was being given to distributors. And to the extent there were government entities that happened to be on the customer list of the distributors that received the supplies, they may have received them. But in terms of what we got as a state, we were asked at the very beginning, Congressman, what do we need? Which is a terrific question for the federal government to ask. So we put forward a list of all the items, gowns and gloves and N95 masks and so on that we needed. We have in total, from the very beginning to now, we've received about 12% of everything that we asked for. So at some point, the federal government just gave up on delivering.
No, I understand what you're saying. But I just want to question, did you receive anything from the air bridge? And the answer is no. Did you receive stockpiles from FEMA at all? Then you decided where they would go?
We did receive, that's what I'm talking about, the 12% of what we asked for. We received 12%, and we were able to direct that where we thought it should go.
And you were aware, were you not, that the biggest problem with the PPE shortage at the beginning of the crisis, and it got exacerbated as the crisis spread, was the fact that our national stockpile was not where it should have been, correct?
That's true, yes.
And that has been a systemic problem that's spanned several administrations, not just this one.
I'm not sure. All I know is the federal government didn't have what it needed.
Right. Okay. That's what I thought. Okay. So tell me, I got a quick another switching gears briefly, Governor. Did you ever institute a policy in Illinois whereby individuals that came from nursing homes that had been infected with the coronavirus were sent back to the nursing homes after being diagnosed?
We did not institute a policy like that, no.
Why not?
We wanted, well, number one, we were making sure that the hospitals were releasing, if they were releasing nursing home residents, that they were COVID free. So
right.
When they went back to their nursing homes, they were COVID free. That was something that we had. And also in our nursing homes, we had a policy of making sure that the nursing homes, or we provided for the nursing homes, the policy that they should separate, of course, COVID positive from COVID negative residents, and many of them did. I will say some of them didn't do it right, and we're holding them accountable.
Okay, thank you very much, Mayor Shelton. I love Elvis, so I'm going to ask you some questions. When I left as a federal organized crime prosecutor in El Paso, my parting gift was a velvet Elvis picture. So, and I still have it in my office today. That was 20 some odd years ago. I'm curious. You're a city of less than 500,000, and where I rep my home's in my area, my district, I have a city of Syracuse, which is less than 500,000, and the county it's in, including the city, is less than 500,000. So, under the CARES Act, they have received no direct funding, and I presume you have not either.
That's correct, Congressman.
Have you received any funding from the state that was sent by the federal government?
No, my understanding is we have not. Now, we have been told that we have been approved for some funding for different things, but as far as actually receiving those funds, and I just asked my communications director to double check, and she said we had not. But my understanding is we've not actually received any of those funds of the $1.2 billion that was sent to the state of Mississippi.
Yeah, here's the oddity with just to the right, Syracuse and the city and kind of on a dog received no money. Similar to you. Just to the west of me is the city of Rochester in the county of Monroe. And because they were just over 500,000, they received over $120 million in the last package. So the disparity in support for the two cities is stunning. So tell me, as a small city, and what you would do if you got that money, and what it would help you prevent to it.
Well, thank you, Congressman, and that is the crux of the matter. So the things that we would do are basic city services. So every business in the city of Tupelo has to make sure that literally the lights are on the streets, that you have first responders, that you have firefighters, that you have police officers, that you have the ability of public works to respond if there's a water break, some sort of, the incidents that happen in cities every single day, fixing potholes, cleaning up, beautifying the city. Those basics are that's what's in jeopardy by the cities collectively losing $360 billion. So, we have the big picture issues in Washington and our state capitals, but the nuts and bolts of American society happens in our small cities and in our counties all across the country. Those basic city services of literally being able to drive down a decent street and have functioning red lights, have your garbage picked up at your curb, have litter or debris picked up, those basic services. And then you get beyond that when talk about economy, the permitting office, building inspections, code enforcement, all of those local offices that are necessary to make sure that businesses are open and running, that a new business can get a occupancy permit, that a new construction project can be inspected. All of those type things are jeopardized by the loss of revenue to cities and counties across the country. When we don't have the money, we have to do cutbacks or furloughs, and those basic city services don't get performed, and it has a direct adverse impact on mom and pop businesses and individual families all across the nation.
I appreciate that. It's very helpful. And lastly, I want to thank you, Governor Pritzker, for acknowledging that you've done an awful lot of learning during this crisis. I think we all have. And I think that starts at the top of government all the way down to the states and locals as well. And we all have a lot to learn from this. And I have submitted a bill to Congress along with my colleague and good friend Stephanie Murphy from the Democratic side of the aisle to form a 9/11 commission type commission after this is all over, to look back and see what we can do better next time. It is easy to criticize, but now I think, as you acknowledge, there's a lot of learning that you did on the job, and I think everyone has from the top down. And with that, I yield back. Thank you.
Thank you very much. Chair recognizes gentleman from Louisiana, Mr. Richmond, for 5 minutes.
Thank you, Mr. Chairman. And I guess following the gentleman from New York, I will, in a minute, call BS when I think I hear BS. Let me start with thanking you for your holding this hearing and your patience. I mean, my colleague from Louisiana, Mr. Higgins, talked about how important it was for people to actually be in the room and be there so that we could have this hearing, as he asked to skip the order so that he could go catch a flight and leave the hearing. So I just want to make sure that while we're having this call, that we're honest. This issue is far too important to the American people to simply politicize it or play defense. Mr. Katko mentioned that learning is important in this role. And I agree with him 100%. But I also would say that accurate information to the American people is very important. And with that, let me just ask one basic question to all of the witnesses. Do you all agree that wearing a mask is a basic tool to containing and beating the coronavirus? Could you answer with a yes or no, please?
Yes.
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 Hearing that we're in unanimous agreement, I think that it is, unfortunately, if we're going to talk about learning, I want to make sure that all my colleagues understand how important it is. My colleague who left the hearing early in his area said, what you're wearing is a bacteria trap. It's not helping your health or anybody else's. That's not learning. That's not accurate. agreement. I think that it is, unfortunately, if we're going to talk about learning, I want to make sure that all my colleagues understand how important it is. My colleague who left the hearing early in his area said, what you're wearing is a bacteria trap. It's not helping your health or anybody else's. That's not learning. That's not accurate.
my executive orders based on CDC recommendations, and then the president gets on Twitter and says, don't believe that. Well, the president's passionate supporters are going to listen to the president and not the CDC. And that complicates the ability of government at every single level to be able to respond to COVID-19. As far as our school district here in Tupelo, it's like you mentioned, a separate school district. They have a plan to reopen in August, but they're kind of going day to day, seeing how the situation continues to unfold. The cases continue to rise here.
Congresswoman, here in Texas, from a public health perspective, Texas Education Association had just yesterday put out some guidelines related to how schools will reopen here in Texas. We had been working with some of our school districts prior to this, and I think the concerns that individuals have is what you've just heard from the governor and the mayor, which is really about not just protecting the students, but also protecting the staff and any visitors that are coming in. It's the entire group of individuals that need to be protected. And so there are concerns that schools have related to that safety piece. Obviously, we have an increase in cases, and we have increase in concern and worry in our community as well as across Texas. So I don't believe it's been worked out, but I will tell you that those guidelines are being looked at very closely, not just at the state level, but at the local level, not just in the education system, but also in the public health system. And the concern is to make sure that we have an approach that, again, is common sense driven, that we want to make sure it's also based on evidence and science, but it also assures the safety and health of everyone involved. And that also may mean that a hybrid approach of in-person, in addition to obviously virtual, that some of those approaches need to be part of it.
Colonel Hastings?
Thank you, ma'am. In Alabama, I'm not the superintendent of schools, but I know that Dr. Eric Mackey has been in close coordination with Dr. Scott Harris, our public health officer. And they put forth a roadmap to open schools that I thought was very reasonable, followed CDC guidelines and public health orders. But ultimately, like in your state, ma'am, here in Alabama, it will be a local decision of how the schools open, because we are a diverse tapestry of 67 counties and a tribe of a multitude of personalities, cultures, and a way of living. And you can't mandate from a central point down and have it work. So I feel like there's enough information out there for our local superintendents and principals to find that happy medium to make parents feel safe, children feel safe, faculty feel safe, and to make sure that children coming together in close quarters, you really need to be careful, because they may be the perfect vector of this disease, and then they bring it back to Alabama. And in Alabama, especially in rural Alabama, we have multi-generational homes. So that is all going into this, and how we use the CARES Act money given to the school districts, and then allowing the counties to partner to operate in a way that is good for them.
Thank you all very much. And thank you, Mr. Chairman. I yield back.
Mr. Chairman, this is Mike Rogers. Can you hear me?
Ranking member, go ahead.
Yes, sir. I just wanted to make sure you were aware that we're having a problem with the public feed. None of Ms. Lesko's and most of Ms. Rice's testimony was not seen. They were looping Cedric Richmond's questioning repeatedly, but it's back up now. But just wanted you to be aware there is a problem.
Well, and I think we were about to recess to create the ability to go online again. Our YouTube channel is down. So thank you, Mr. Ranking Member. And we'll recess shortly and reconvene subject to the call of the chair.
Mr. Chair, this is Congresswoman Lesko. I have a question. Mr. Chair, I just want to know if, because I have another appointment I need to go to, if I have to re-ask my questions, or are the questions recorded and the answers that the governor gave so you can rebroadcast them later?
Well, I can't give you that question yet. I'll talk to the technical people. If we can, we'll do that. Other than that, if you can submit it in writing, I'm sure we can get it. But the technicians are working on the problem right now. We'll recess subject to a call of the chair.